again in the midst of our 2020 hurricane season, which is predicted to be above normal. We had a little panic over the weekend with Tropical Storm Gonzalo. Thankfully, it dissipated. The downstream impacts for these hurricanes are likely to include heightened stress, fear, depression, and anxiety across populations that are already coping with COVID-19 impacts. Personal resilience is a key requirement for sustainable human development, and its nexus with mental health and wellness and positive coping strategies is well documented. Yet, these are areas that are often overlooked. With the emergence of COVID-19, we have expanded the scope of the collaboration to include the pandemic. This 2020 campaign builds on last year's Stronger Together campaign. We have adapted or developed a number of resources such as psychosocial first aid guide, social media cards, and a jingle for use in this effort. The call to action, connecting to feel safe, calm, and hopeful, aims to offer information and strategies to assist communities in promoting mental well-being and positive coping strategies and raise awareness to reduce the stigma about seeking mental health and psychosocial support, while also considering social distancing protocols. The expanded project, initially designed to strengthen in-country competencies to conduct needs assessments and action plans, as well as training journalists and health communicators, has been further adapted to include work with social media influencers and DJs, and the use of mobile app technology to reach wider audiences. We invite you to use and disseminate these resources widely to support those in need and to encourage them to seek help as required. In this way, we indeed will build resilience and we are stronger together. Thank you.
Thank you so much, Ms. Clarendon. And we know that Ms. Choutinier is very happy to have you on board once again with this campaign. And she's all about technical cooperation and working together. We now ask Ms. Choutinier, Sub-Regional Program Coordinator for the Caribbean for the PAHO office, to bring opening remarks. Jessie?
Good morning and welcome from the PAHO Caribbean Sub-Regional Program. Connecting, feeling safe, feeling calm, and feeling hopeful. How do those concepts resonate with you? Well, today we're launching, in collaboration with the Caribbean Development Bank, a campaign on mental health and psychosocial support entitled Stronger Together. And the theme, as we just heard, is connecting to feel safe, calm, and hopeful. There couldn't be a better time for this, as we're all feeling the need to connect and feel safe and feel calm and hopeful. It's been 6 months since WHO declared COVID-19 a public health emergency of international concern. And for the last 6 months, our lives have been transformed in some way, shape, or form due to COVID. Who would have imagined this unprecedented situation just 6 months ago? We have been faced with prolonged periods of lockdown, not able to connect with our friends, families, co-workers. Children have said that they feel unsafe, with routines changed, schools closed, and dealing with homeschooling. Many people are feeling uncertainty as large numbers are affected by loss of livelihoods and feeling fear and anxiety due to the economic consequences of COVID-19. This unprecedented situation has taken a toll on our mental health, triggering reactions of depression, anxiety, and worry. Urgent action is needed as we have the seeds of what could become a mental health crisis. In the Caribbean, we're dealing with COVID-19, but we're also in the midst of a hurricane season. Many of the islands are still recovering physically and emotionally from some of the major hurricanes over the past few years, including Irma, Maria, and Dorian. And just last week, as was mentioned by the CDB, several Caribbean countries were preparing and closely watching Tropical Storm Gustavo, which luckily bypassed us, but it's a stark reminder of this reality. PAHO and CDB are responding to the situation with the Stronger Together campaign. The Stronger Together campaign aims to offer information and tools to promote mental well-being, coping strategies, and to raise awareness to reduce the stigma about seeking mental health and psychosocial support. The campaign is being rolled out during the hurricane season, building on the branding, the key messages, and the communication products from the 2019 PAHO CDB Stronger Together campaign. This campaign incorporates specific tips and recommendations related to COVID-19. Connecting to feel safe, calm, and hopeful. That's the call to action. The aim is for communities, including vulnerable groups such as children, adolescents, men and women, people with pre-existing health, mental health, and substance abuse conditions, older adults and their caregivers, people with disabilities, migrants, ethnic minorities, to all feel safe, calm, and hopeful. This message is also for essential workers, community leaders, and owners of medium, small, and micro enterprises, many of whom are challenged by the economic impacts of COVID-19. The campaign also includes an explicit effort to integrate gender norms to ensure inclusive and protective language that works for women and men, boys and girls. Moreover, we're working to make all communication materials fully accessible for persons with disabilities. And I'm very pleased that this session this morning is offering closed captioning and sign language interpretation. During today's launch, you'll have the opportunity to become familiar with the communication products and the campaign. We're excited to share with you a radio jingle, a radio public service announcement with testimonials, an illustrated booklet on psychological first aid, an audio version of the booklet, social media materials, and human interest stories. We have a dynamic panel lined up this morning comprised of civil society, a clinical psychologist from the Bahamas, and one of our PAHO mental health advisors. Kimberly Hibbert, a senior reporter with the Jamaica Observer, will moderate a panel and open conversation on the key messages of the campaign. We're pleased to be joined by media journalists as they have a critical role to play in keeping people informed, ensuring that information comes from a trusted source, and addressing stigma related to COVID-19 and mental health. Our intention is that the Stronger Together campaign serves as a conversation starter about this important topic. We really hope that you'll enjoy the launch today. We would love for you to get involved in the campaign. You can be involved by using and sharing the various materials and by spreading the word. Before I close, I'd like to express our gratitude to the Caribbean Development Bank for their commitment and their partnership in promoting mental health and psychosocial well-being for the Caribbean people through this and other projects. So thank you again for spending your time with us this morning. And remember, there is no health without mental health. Thank you.
Thank you so much, Jessie. You definitely hit on all of the points that are going through my mind today. Stronger together. We have to come together to work on these issues, and definitely now COVID-19 being one of the issues that we have had to incorporate into the materials. Now, to tell you more about the materials and what the campaign has to offer and the fact that we want you to be a part of the campaign is Dr. Elisa Prieto. She's advisor on NCDs and mental health for the sub-regional office at PAHO. Elisa?
Hi, good morning. I'm going to turn on my camera to greet you, and then I will switch it off while I present to preserve with band. It's a real pleasure for me to be with you this morning. I'm really happy that you're joining us for this launch. And I will, in the next few slides, walk you very briefly through the campaign and the communication products. I think the opening remarks have done a terrific job at outlining the different layers of distressful situations that we are experiencing in the Caribbean at the moment, from the COVID-19 pandemic, which has changed everybody's lives in an unprecedented ways, its economic impacts, and now the hurricane season. Everyone is affected by these circumstances in one way or the other. And there are a wide range of reactions and feelings that we can all experience. But what we do know is that people who feel safe, connected, calm, and hopeful have access to social, physical, and emotional support and find ways to help themselves during and after a crisis are better able to recover long-term from mental health impacts. And this is exactly what we're trying to achieve through this campaign. As was mentioned in the opening remarks, the campaign aims to offer information and tools to assist communities in the region to promote mental well-being and positive coping strategies, while raising awareness to reduce the stigma about seeking mental health and psychosocial support. It really aims to be a conversation starter about this difficult topic. And one of the focuses is to convey the principles of psychological first aid, also known by its acronym PFA. And we'll learn a little bit more about this as I walk you through the presentation, but also later on in the panel. So what are the guiding principles of the campaign? We have made a very explicit effort to integrate gender norms, roles, and relations into the key messages and the communication products of the campaign. We've also made an emphasis in including a protection and inclusion lens, and we really have aimed to focus on vulnerable groups. And as was mentioned, we are trying to make all communication products and campaign events fully accessible for persons with disability. Another guiding principle is building on existing communication materials. As was mentioned, we are building on the PAHO CDB 2019 Stronger Together campaign, and also borrowing and disseminating some of the PAHO WHO COVID-19 communication materials. And I would like to encourage you to visit the webpage, which has a wealth of materials covering different topics, including mental health and psychosocial support.
Elisa, are you sharing your slides? Because we're not seeing it as yet.
Yes, I am.
Okay, we're not seeing it as yet.
Oh. Alrighty, so I'm glad you jumped in. Are you seeing them now?
It's coming up now, yes.
Okay, I wasn't showing any of the communication materials yet, so that should be okay.
Yes.
So I was just about to share a little bit about the 2019 Stronger Together campaign, and this is to say that it was a very well-received campaign. The campaign's webpage was the most visited page of our PAHO Sub-Regional Program website, with a quarter of all the page views during the time the campaign was rolled out, that is during the 2019 hurricane season. The PFA illustrated booklet, which I'll share with you in a few slides, was downloaded over 3,000 times. And the 47 posts that were shared in PAHO's main institutional and social media platforms gained over 300,000 impressions during the months of July to October 2019. So who are we targeting with this campaign? Our target audiences are communities, and again, the emphasis is being made on vulnerable groups, essential workers, community leaders, and decision makers. And this year, we are incorporating owners of medium, small, and micro enterprises, acknowledging that they are really suffering the economic consequences of the COVID-19 pandemic and require special attention. We have a set of overarching messages. There's more detail about this in the campaign's website, which I'll share with you at the end of this presentation. But really the core messaging is around togetherness, working together as a community, self-care, avoiding fear and stigma, specific messages for men, women, and children, including violence prevention and positive parenting tips, promotion of inclusion of persons with disability, and there are also a set of specific messages for essential workers and decision makers. And how are we communicating these messages? We have prepared a set of communication products, which include a radio jingle, audio PSAs, public service announcements, and testimonials, a social media package, a PFA psychological first aid illustrated booklet with an audio version, and human interest stories. And these last two will be coming soon. The communication materials will be implemented during the hurricane season, July to November 2020, and we really want to encourage you to use and adapt these communication materials. And at the bottom, you have the webpage of the campaign. So the core product of the campaign, I would say, is the Pfa Booklet. This is a tool that was developed last year with the aim to help you and help your community to take care of yourself during crisis situations. And this is achieved through psychological first aid, a humane, supportive, and practical response to a fellow human being who is suffering and may need support. The first edition of this booklet was developed by a team comprised of 2 illustrators, a scriptwriter, and a clinical psychologist. And I want to emphasize that it was done in consultation with over 20 Caribbean persons of diverse backgrounds and later field tested in BDI. So we really made a big effort to make it culturally appropriate. In the booklet, which uses a comic format, the main character is the PFA helper, who guides us through the 3 basic principles of PFA: look, listen, and link. This is aimed to help you approach affected people, listen and understand their needs, and link them with practical support and information. It also brings attention to the needs of specific groups, including men, women, children, adolescents, and people with disabilities, among others. So in the next few slides, I just want to touch on some of the things that are new in this second edition. We have incorporated tips and recommendations to provide PFA in a safe way during the COVID-19 pandemic. And these are just examples of basic protection measures and some tips about remote communication. We have integrated specific messages around managing the near constant stream of information in news and social media that can cause feelings of anxiety and distress. And we have also integrated some tips about keeping children and teens safe when they're online. And we all know that that's been happening a lot more lately with the lockdown measures. We've integrated some violence prevention messages, acknowledging that the risk of violence can increase during crisis situations and due to the lockdown measures that we have been experiencing. And based on the PFA booklet, the campaign also includes a social media package. And these are just some of the social media cards that we've worked on. You have the hashtags that we are proposing at the bottom of the slide: look, listen, and link, psychosocial support, stronger together. And we have organized the social media cards, which are a total of 30, into 10 weekly themes with 3 new cards per week. In the webpage, you will find a social media toolkit, which includes the proposed messages, word tags, and the social media cards, and they are structured around these themes. As was mentioned at the start, we also have some audio products, including a jingle and some audio PSAs and testimonials, which can be found on the webpage. And then coming soon, we will have an audio version of the PFA illustrated booklet. And both the PFA booklet and the social media toolkit will be available with alt text. This is with the aim to increase and enhance accessibility. We will have 3 new audio PSAs and 4 human interest stories. So stay tuned for related events. And before I finish, I'm hoping I'm not going over time, I would like to very briefly share with you the website of the campaign. You have the link in the presentation. Here you will find a description of the campaign. You will find the key products that I've mentioned to download, the social media kit, the jingle, the PSAs. You will find a fuller description of the key messages, and here you just click and you get the key message. And at the bottom, you have all the social media cards available to download and use. So before I close, I want to play for you the radio jingle. This is the same jingle we produced last year with a small tweak in the chorus. We really have tried to make the focus of the campaign broader. as I was saying at the start, to acknowledge the different layers of stress that we are experiencing at the moment. So the focus is not so much on natural disasters, but in crisis situations more broadly. And this is the change we've made to the jingle. But I think everybody received this jingle very well last year. It's a happy jingle. A jingle around the idea of community, togetherness, one love. So I thought I would close playing it so we have a smile on our face for the next session. So I'll just play it and then over to you, Lisa.
Be ready to love, listen and link. After crisis or disaster, love, listen and link. Because we are stronger together. It's okay to talk about how you feel inside. Shows the strength you have in you to make it all alright. Look out for the children, women and elderly, so all of them know, you know just how they feel. Ready to love, listen and link. After crisis or disaster, love, listen and link. Because we are stronger together. You think about others, but don't forget about you. Listen to your brother and he will listen to you. You're never alone. Don't accept no violence. Reach out to your neighbor. Don't suffer in silence. Be ready to love, listen and link. After crisis or disaster, love, listen and link. Because we are stronger together.
This message is brought to you by the Pan American Health Organization and the Caribbean Development Bank.
Thank you so much, Elisa. Yes, I'm sure you guys saw me dancing to that one. You cannot hear that and not at least tap your leg. It's a wonderful jingle, and I really, really hope that everyone uses it and I hear it being played across the Caribbean. I'll be giving you guys a call in the media if I'm not hearing it, because I know it would be an oversight if we don't hear it. So it's a good way for us to move now into our panel discussion, and it's going to be moderated by Kimberly Hibbert, senior reporter at the Jamaica Observer. And the discussion is on the title of the campaign, basically, and the call to action: Stronger Together, Connecting to Feel Calm, Safe, and Hopeful. I'm going to throw directly to you, Kimberly, and your panelists. Thank you.
All right, thank you very much, Lisa. I hope everyone is hearing me clearly. I absolutely also enjoyed listening to that jingle, and I'm sure it will catch on like wildfire throughout the Caribbean, and we'll actually hear the messages clearly. So this morning's panel discussion will be around the campaign, which is Stronger Together, Connecting to Feel Safe, Calm, and Hopeful. So as a moderator, I'll just take chair's privilege and start us off by just telling us why the role of media is important during this unprecedented time. So I also hope that we'll have a very spirited discussion, and at the end we'll all see the need to get on board and move the campaign into implementation and fruition. So the media tends to focus on mental illness as an individual rather than the illness itself, right? And it's often depicted as unprofessional and untrustworthy by our colleagues, as we often create a strong negative stigma surrounding treatment seeking. Now, this often results in high levels of stigma, often in turn affecting those who have mental illnesses, and they become less inclined to seek help from a professional. However, the media can influence help-seeking behaviors. As media, we set the agenda, and we're powerful in shaping public perception. In our roles, we should aim to change the narrative of a positive reinforcements of mental health, mind our language and images, mind how we focus on the individual as the illness rather than the individual as a person who has a particular illness. Also mind how we add to the stereotypes, right? And if you're in the last training or not, you can also refer to the PAHO Caribbean Development Bank training, and it's on YouTube. And it speaks about our experiences with mental health and the COVID-19 pandemic, stigma, and how we have a far way to go in terms of shaping public perception. Furthermore, our role as journalists, communicators, and media professionals as a whole is a very powerful one, and we should really take that very seriously. As it relates to the Stronger Together campaign, we want to ensure that as media, we tap into key messages in the campaign that relates to us. Some of these include seeking information only from trusted sources, such as the WHO or the PAHO website, or our local public health agencies, and mainly taking practical steps to protect ourselves and our loved ones. We should also seek information updates at specific times during the day, once or twice. Get the facts and not the rumors. Facts can help to minimize fear and stigma. Also, as it relates to stigma, COVID-19 is affecting people from many countries and many geographical locations. As a result, we should not attach it to any ethnicity, disability, nationality, or profession. Be empathetic to all those who are affected. They have not done anything wrong, and they deserve our support, compassion, and kindness. Find opportunities to amplify positive and hopeful stories and positive images of local people who have experienced COVID-19. Now, with that said, we'll just get right into the discussion. We have a very lovely panel lined up. We have Maisha Hutton, the Executive Director for Healthy Caribbean Coalition. We have Claudina Cayetano, Advisor for Mental Health with PAHO, and Wendy Fernando, Clinical Psychologist, Sandylands Rehabilitation Center in the Bahamas. So we'll start off with Claudina. The work you do tends to focus on some of the ways that we can best cope with difficulties, working together through this situation, and normalizing feelings of distress, sadness, worry, and not stigmatizing it. Now, I want to know, how does this fit into this unprecedented time of COVID-19? I know we also are in the hurricane season.
Thank you, Miss Kimberly. And it's such a pleasure to be surrounded by panelists who are by themselves, are brilliant people in the work that they're doing, particularly, and I'm so pleased to hear your introduction about the role of media in terms of language matter. So it brings me really great pleasure in the work that I am doing in the importance of mental health. As you know, miscommunication increases anxiety, increases fear. And as an advisor working for PAHO on mental health, it is very important for us to reduce the stigma, to be able to increase health-seeking behavior, to be able to have people really care for their mental health. So when you care for a mental health, when you have information that is accurate, when you know how to provide safety for people, how people can be able to access help or access care, then they are taking care of their mental health. And this is so important for us, specifically now, as you mentioned, for the Caribbean, one that we're facing COVID and one that we are in the hurricane season. So extremely important to take care of our mental health.
Right, Claudina, still with you. You speak about the importance of taking care of our mental health during COVID-19 and the hurricane season, which can cause adverse distress among people. However, some of the key messages of the campaign speak about distinguishing distress reactions as opposed to severe distress reactions, highlighting vulnerable groups that are likely to need special care in a crisis situation. Also, the campaign speaks about the psychological first aid. Right, I want to know what exactly is the psychological first aid, what are the core principles of it, and how does it fit into what we're experiencing right now?
Thanks for such a practical questions. When we talk about in our context, when you say mental health, we think mental illness, we think crazy, we think something that, that doesn't apply to us. But here what we want is for people to be able to be more serious and more cognizant of their well-being. So I'm very pleased that this campaign is focusing on PFA, which is the acronym for psychological first aid. So you think about first aid, when you say first aid and then you add the psychological part to it, that means, looking care of your mental well-being. So the principles is look, listen, and link, which is the jingle actually helps to give it some more life. I like that jingle in terms of look, listen, and link, because what we want is for people to be able to promote a sense of calmness, promote a sense of hope, look, listen, and link, looking for opportunity to support people who are vulnerable, to support people who are in distress during a crisis. And you want to be able to listen without pressuring them to speak, we listen to their concerns, to be able to provide, where are the base, linking them to basic services. That's what we're looking for in this campaign. So it's a PFA. This jingle actual capture the principles of PFA. Look, listen, and link.
Right, and I'm also assuming that this aspect of the campaign also encourages people to draw on some of the skills that they've already used in past situations to manage difficult times, manage their emotions, plan where to go, seek ahead for help, physical, mental health, psychosocial needs, and so forth. On that point, I'll sort of bring Wendy into the conversation. You are a clinical psychiatrist, I believe, or psychologist. Correct me where I went wrong. However, you would have seen some of the issues that our essential workers would have faced during COVID-19 in terms of the stigma they also faced, them being a vulnerable group. What sort of advice do you have for them during the pandemic as it's still going on, and how to manage natural disasters? Is Wendy here?
I think I had a cutout. Sorry. Can you repeat it for me, please?
Sure. I was saying that you are a clinical psychologist.
Yes, I am.
And you would have been aware of some of the issues that some of our essential workers faced at the onset of the COVID-19 pandemic with stigma. And as it's still going on, some of those stigma issues are still very prevalent where our essential workers are concerned. They're also a vulnerable group. And now that we're in the hurricane season, it's almost as if it's a double whammy. So what sort of tips do you have for them?
Okay, absolutely. One of the things that we have found, not just for hurricane, but essential workers responding as it relates to COVID as well, is we find that they are faced with stigma. They are experiencing isolation from family members and maybe even the communities in which they work. And so one of what we would like to say, what I would like to encourage them to do is to take the time to take care of themselves, to remember that they are important and to remember that the work that they do is very important. So value themselves, see themselves as even the profession that they've chosen, see that as an important aspect of the community, and to learn to say no, to learn to gauge, not feeling as if they have to do everything that comes their way, that they can say no. And I often say to people that no is a complete sentence. So self-care, I think, is very important. I'd like to say, take care of yourself. Take the time to take care of yourself, recognizing that, you are important and that it's not a selfish act. It is just being a good steward of the gift that you have, which is taking care of yourself.
Right, Wendy. It's interesting that you mentioned that, because I'm not sure if the saying goes for the rest of the Caribbean islands, but certainly in Jamaica, we have a thing to say, he who pays the piper calls the tune. And a lot of times when you opt to take a wellness check or a mental health day to sort of, pull back from the stressors that you're told, it's your job and you have a duty, and it's either you do it or you're out. So how do they navigate such a situation?
Okay. I would like to say, as unique as you think it is in Jamaica, it's something that I know that we experience here as well. And how do you navigate is essentially recognizing that what you do for you as an individual may be different from what someone else does. And really you don't have to, you don't necessarily have to ask permission from anyone in order to take care of yourself or to take time for self-care. So that's what I would really, I believe that's important, and to realize that self-care is a very important, given where we are, given the situation that we are all facing it, not just in the Caribbean, but globally. Okay, that we can, it's important to help us to cope with the distress and the anxieties that we may be feeling. So that's what I feel that's important for persons who are first responders, and for all of us actually.
Right. And what are some tips for self-care in terms of maybe listing them, bullet points, some practical ways people can actually take care of themselves?
Okay. Really, one of the things like I said, is to just value you. Value you and learn to say no, and to give yourself the permission to take time out for you, and to find healthy ways to deal with stress, such as meditation, such as dancing, such as listening to music, such as engaging in mindfulness exercises. Eat well, find yourself fruits and vegetables, and laugh. If it means turning on the television and watching a comedy show, allow yourself the opportunity to laugh, engage in situations or in company that causes you, that allow you to laugh. Visit friends, or in this COVID, reach out to friends and family members that you have the relationship with that is positive. Avoid alcohol and other drugs, excessive alcohol use, and avoid drug use. And give yourself a gift, buy yourself a gift. And it doesn't have to necessarily be anything extravagant, expensive. It could be something very inexpensive and simple. Just take a few days vacation. I mean, all of us have been going. I know for me here in the Bahamas, I've been going since September, since the September 1st. Hurricane Dorian, and just as we were about to say, okay, let's put something in place for a preparation, then COVID hits. And so we haven't been given the opportunity, a lot of us in mental health who've been working, to take a break. But I advise that you take a few days, just some me time. And it's not selfish, as I stated. And then take and sleep. We underestimate how important it is to sleep, to get the appropriate amount of sleep. Take some time to spend some time, just sleep. Ensure that you get 7 hours of sleep, good undisturbed sleep. And as I say, exercise, walk, and it doesn't have to be anything rigorous or long walk. It's recommended that 30 minutes of walk is really helpful.
All right, so I believe that our attendees will be walking more, eating more healthily, going to our beds earlier, and also maybe signing up for some vacation leave soon. But on this point, I sort of want to bring Maisha into the discussion. What you do surrounds non-communicable diseases, and this is something that plagues the Caribbean. It's on the rise globally. And during natural disasters, pandemics, this can really intensify when you don't have access to the proper services or things that aid in your well-being or your treatment for some of these non-communicable diseases. So I want to know, you are with the civil society. How do you promote positive coping strategies among people living with NCDs?
Thanks, Kimberly. As the Regional Alliance of Civil Society Organizations in the Caribbean, working with over 100 health and non-health NGOs, when the pandemic arrived with the news that those who lived with NCDs were amongst the most vulnerable to severe infection, we knew that we had considerable work to do to help to really assist those people living with NCDs to navigate the pandemic, not only to protect themselves from transmission from COVID, but also to ensure that their mental health and their coping with the stress and the anxiety around their own possible contraction of coronavirus was priority for us. And so we've sent a letter to the heads of CARICOM asking them to put in place urgent strategies to help protect people living with NCDs. And we launched an advocacy and communication plan with our membership, which contained 5 key priority areas. One was promoting good mental and physical health. And one of the other objectives there was engaging youth. We recognized these 2 populations were particularly vulnerable. And so we also started to look and see what were some specific programs that we could put in place to help people living with NCDs to cope with coronavirus and the pandemic. And we launched My COVID Story, which is really a platform to help people who are living with NCDs share issues around anxiety, their coping, their challenges and successes, and how they've started to overcome. What have they put in place to help them cope? Are they engaging in physical activity? Are they obtaining psychosocial support from their local civil society organization? Are they eating well? And what strategies are they using to eat well? Are they having backyard gardens? Are they ensuring that they're not consuming alcohol and tobacco and drugs, as was mentioned by some of the earlier panelists? So we really tried to focus on specific strategies to help that specific subgroup to better cope with the stress and anxiety around coronavirus. The other piece too was engaging with young people, because we recognize that they played a really critical role and that they have their own unique coping issues. And we've launched a webinar series called The Future Talks, which is provide a space for young people to talk about their concerns, in particular around mental health and how they've been coping. And our last webinar featured a young clinical psychologist from Trinidad, again, sharing specific strategies for young people, for children, as well as teens and young adults, and how they can specifically cope with COVID, whether it's dealing with issues around disruption of education and schooling, fears and anxiety around contraction, and also passing the virus on to older relatives. We've really tried to provide that support as well. So the campaign, we congratulate CDB and PAHO for this campaign. Stronger Together, that's the motto of HCC and bringing together civil society organizations across the region. And this current call to action around connecting to feel safe, calm, and hopeful, I think that is really important for people living with NCDs and others who experience vulnerabilities at this time. So we are fully supportive of the campaign and look forward to disseminating it throughout our membership and using our actors, our civil society members to really bring life to it within their countries.
Right, Maisha, just this morning in one of our news reports, a professor from the University of the West Indies said that the present COVID-19 pandemic, as well as severe weather conditions that we may get from hurricanes, may result in food not being readily available, accessible, or affordable. A lot of what you touch on with the NCDs and so forth has a lot to do with access to food, affordability. Do you see this as a problem coming forward, and how can people really navigate such a situation?
Yeah, we do actually see it as a major problem. Access to healthy, nutritious food is one of the other pillars of our communication advocacy strategy, realizing that there could have been disruption in local, regional, and global food systems, which impacted upon the food supply, especially for us as island states to a large degree. So we worked with the OECS to launch a joint statement, really kind of outlining priorities around access to essential food, to healthy food over the course of the pandemic, in particular for children and for people living with NCDs. And so one of the initiatives emerging out of that was the idea of improving household security through the backyard garden initiatives. And in tandem with that, we've also been advocating at the national level to CARICOM governments around how we can increase regional food security so that we can build greater resilience and reliance and sustainability within the region, especially as it relates to food security. And that involves a number of specific strategies, but certainly it's been a priority for us at both the individual and the regional level.
Right, and some of the key messages touch on those things that you mentioned. They also touch on the need for children to feel love and attention during this difficult time. Sometimes we tend to be a bit rough on our children, so we encourage parents to sort of have these conversations and show children, that they are loved and they have the support during this unprecedented period.
Yes, and those are very important messages for us. And I think we've also, some of the previous panelists have been talking about workplaces, and we've been doing some work with some of our partners in workplaces and speaking to parents about the need for work-life balance and how stressors at work impact their role as parents when they go home, and what strategies they can implement in their households to protect their children, whether it's decreased screen time, whether it's managing the homeschooling, and as we embark upon this kind of unknown territory as we approach the new school term, I think parents and educators are going to have to think about how we are going to put in place systems to protect children, to kind of foresee the mental health issues that they have, and to minimize and to manage the stressors, and to ensure that they are coping with this unknown experience in the coming months.
Okay, Maisha, thank you very much. And I'll just go to some questions that we've been getting. Right, so Virginia Oostberg, I hope I have that correct. She's asking, what advice do you have for private initiatives to support this campaign? And can these private entities, such as communication institutions or community civil society organizations, use these materials and brand the materials with their logos? I believe Maisha and Elisa can speak to that. Maisha could speak to the civil society aspect, and Elisa could speak about these civil society organizations actually using their logos on the materials.
Sure, thanks, Kimberly, and thanks, Virginia, for that question. We want to have our materials out there, so we are encouraging countries, partners to use them. As for the logos, we would need to clear that. We, of course, always conduct due diligence to ensure that we engage in partnerships that are safe and in terms of our public health objectives. So that would require a request, and we would look into it and provide clearance together with our CDB, our partner in this project. But we definitely want to have the materials out there and encourage everybody to use, disseminate, and spread the word. So thanks for that question. And if I may, because I see another question from Virginia around whether the campaign package includes tools for faith-based organizations and religious leaders on how to use the materials in the work. If you don't mind, Kimberly, I can also take this one. That's a great suggestion, Virginia. We are targeting community leaders both as a target audience, but also thinking of them as channels, acknowledging precisely this. We don't have specific materials tailored for for faith-based organizations and religious leaders, but this is a very good suggestion, and maybe something that we want to look at, see how we can tweak some of the materials so that they can play a more meaningful role in disseminating and using. So thanks a lot for that as well. Over.
Right, and I think she also, the question went, but she had also asked about civil society and private entities, if they can use the materials. I think Maisha could respond to that.
In the interest of time, I'll be very quick, but just to say that I think civil society organizations, we've been featuring the work that they've been doing to fill service gaps for people living with NCDs. And certainly one of the gaps they've been filling is providing psychosocial services. So I think that I can comfortably say, I believe civil society organizations would be very keen to use this material to support the work that they've been doing.
Right, and Claudina had raised her hand shortly. I think she wanted to add.
Thank you. It's just because I think it's very important that this material can be used by anyone. You don't need to be specialized in mental health to be able to do this. I think it's important to understand that, this is for people, it's a training There is through the PAHO virtual campus, we also have this self-learning course on PFA, psychological first aid. And the idea here is to promote sense of safety, is to promote sense of efficacy, promote connectedness, promote hope. So people can learn these skills very easily. They don't need to be mental health professionals. So that's the advantage. Thank you.
Right, and very excellent point made. I see some comments coming in from India and from Grenada in the chat. That's lovely. King Shook, I believe, has a question for both Maisha and myself. He says, do you feel that we should really do away with the phrase social distancing and replace it and use physical distancing? COVID-19 pandemic requires physical distancing and not social distancing. The word social and the phrase social distancing have a large connotation. I believe that sort of refers to or social interactions as opposed to the literal sense that we're physically apart from each other. Claudina, do you think you want to take this one?
Yeah.
Yes, actually, PAHO, that's exactly what we promote from PAHO. So Lisa, Elisa, Jesse, all of us will be out on board with that. All of us PAHO staff know that what we are promoting is physical distancing. We need to be emotionally connected. We need to promote emotional connectedness. That's extremely important. But it's a physical distancing, it's not a social distancing. Totally agree. All our materials, everything that we've been promoting is precisely that, especially in the face of COVID. And with the challenges of the hurricane, we also keep that in mind, that this is more important than ever that we be socially connected. And I think you made that point too, Kimberly, when you spoke at the beginning. Thank you.
Right. There's a question or a comment from Suriname. They say that, they also experience the same issues with the nurses there. And they're very grateful to us for actually speaking about these things. Someone has a question as it relates to self-care. I believe this is for Wendy. Or rather a comment. They say they just wish to add the importance of warm baths, inclusive of body massages for essential workers after a long day and the regular practice of meditation. And that's from Marcia Munnings, head of Healthy Bahamas Coalition, Ministry of Health. And Sharon Enriquez says, as a tertiary educator teaching during the onset of COVID, she has had to adjust to her students' mental status. So how can she continuously support and provide for her students who are expected to do online classes at home? So Claudina, do you wish to take that?
About the students you were saying?
Right, how can she support the students who are expected to do online classes at home?
Oh, I think one of the things that we also been advocating is the importance of the mental health literacy for students and for teachers. Again, here what you're looking for, and we have a program that we have been running. We did it in Bahamas. We also did it in Belize, and now we have it online. We did it for Jamaica, actually, and the Ministry of Education. The idea here is that it's very important that mental health literacy be embedded in the education, and that teachers, parents can have the skills to be able to, we don't want them to diagnose, that's not what we're looking for. We just want them to have the skills to detect when the students are having some difficulties. Learning virtually is something totally new for most people, and going to schools, if schools are open, it brings a lot of anxiety about COVID. So that can create, increase their affect the performance at school, higher chances for anxiety, for depression, for suicide attempts. So it's so important that we build the mental health literacy, and that teachers and parents have the skills to look at what are these cues when kids are having difficulties. So again, it's not about diagnosis, it's just for early intervention. And we also from PAHO and UNICEF, we have these weekly hangouts for adolescents, just that, to have them start to become connected about their mental health. I know in the interest of time, I have to be short with his answers. Lisa is looking at don't want to overstep, but just to make the point, it's definitely important to bring that to schools.
Right, and I think some persons had concerns about, people with their various challenges as it relates to online classes, as it relates to mobilizing efforts to assist them virtually or remotely. And I believe that the materials in the campaign package actually speaks to that, and that's available for download. And in terms of the PFA, someone wanted to know, when people try to help by using the principles of the guideline, how do they know when more help is needed than they're able to provide? And that with that question, I think anybody can take it, maybe Elisa, and then we'll just wrap up.
Sure, thank you, Kimberly. So thanks for that question, Peter. It's a very good one, and that's something I failed to mention when I was giving an overview of the booklet. So that's another thing that we've tried to emphasize throughout the booklet, especially in the look section, helping distinguish between expected distress reactions and severe distress reactions that may need additional help. Not just acute distress reactions, but also signs that if they interfere with daily functioning or last as an extended period of time, may make it advisable for persons to seek help. So that is something that we've tried to include in the booklet as it relates to depression, PTSD, grief, and again, a big emphasis on seeking help in the case of symptoms, signs and symptoms of severe distress reaction. Similarly, we've emphasized this messaging of keeping safe, prioritizing safety, not just when providing PFA, but also as it relates to other specific topics like violence or suicide. So we've tried to make that very clear throughout the booklet. Of course, this is an illustrated booklet, so it's just one tool. But that's a very good question. Thank you. It allowed me to clarify this. So over to you, Kimberly.
Right. So that's the end of our panel discussion. And I trust that you were all well informed. You enjoyed the discussions. You learned a lot more than you had already known. And that you will now be downloading the packages and learning more, implementing them in your various organizations and your places of work. And now I'll just hand right back to Lisa.
Thank you, Kimberly. Thank you so much. That was a very interesting discussion, and I can tell it could go on, but the good news is on Wednesday at 2 o'clock, we're going to be having a Facebook Live on this campaign and the issues surrounding it. So all of these questions, I've saved them so that if you forget or you're not able to log on, you'll be able to have those questions answered. And this will also be available on PAHO TV. It is also streaming right now on our PAHO Caribbean page. And you can actually download an extract right now. If you click closed caption right below, you can actually view a full transcript. And I know you journalists, you love that. Some of you may have had to move away, but you can download that extract, that transcript, and just go on with writing your stories. We thank you in advance for the many stories you will write on this launch and the use of the material. So it's just my time now to say thank you to everyone. I think this went really well. Thank you to those who brought the opening remarks. Ms. Clarendon and Ms. Choutiné, thank you very much for bringing those remarks and pulling it all together. To Dr. Prieto for bringing this baby along again. I think it's not a baby anymore, a toddler from last year, getting older and learning and doing things even better. Thank you to those who provided the sign language for us and the closed captioning. There is someone who actually makes that available, so thank you for doing that for us. Our moderator, Kimberly Hibbert, I see you're going to be a partner with us on this moving forward. And thank you for doing this for us today. And of course, our panelists, Maisha Hutton, Paulina Cayetano, and Wendy Fernander. And all of you for joining us. Thank you very much. And David Spitz for working in the background and making sure that this all came together. Thank you so much for joining us. Please do enjoy the rest of your day and join us on Wednesday at 2 o'clock on Facebook on the PAHO Caribbean page for more on this interesting discussion. Thank you and have a great day. Bye-bye.